everyone, I'm glad you're here. Thank you very much for joining me. I'm Mary with MaryGreeley News. Well, Ebola now has been ruled off after a terrifying scare, a suspected Ebola exposure at a Manhattan urgent care facility where 2 patients were rushed to the hospital by emergency workers in hazmat suits today. But they're now saying that the infection may be norovirus. The 2 patients were transported from a city MD on East 125th Street and Lexington Avenue by first responders wearing hazmat suits, law enforcement sources said. Officials feared Ebola infections because patients had traveled from Uganda and had symptoms consistent with the disease, but no tests had confirmed its presence, the source added. Health officials later said the sickness had spread quickly between family members, which meant it may be more likely to be norovirus. Health officials from the African Center for Disease Control and Prevention, Africa CDC, today said that Uganda's Ebola outbreak has stabilized and is under control, with the ongoing epidemiological investigation suggesting a single transmission chain. At a media briefing, head of Africa CDC Mpox Incident Management Team said the outbreak total stands at 9 cases, which includes 5 healthcare workers. The fatality count remains at 1, for a case fatality rate of 11.1%. The patient who died in this index case, a 32-year-old male nurse who became ill in mid-January. He visited a traditional healer in 3 different health facilities before he died in Kampala. So they're saying it might be norovirus and not Ebola. What are your thoughts? They said they had symptoms of Ebola. On the CDC website, it says on February 5th, they issued a travel health notice level 2, practice enhancement precaution for people traveling to Uganda. Currently, the CDC does not issue any interim recommendations to health departments for post-arrival risk assessment and management of travelers, including U.S.-based healthcare workers arriving from Uganda. CDC recommends that travelers monitor themselves for symptoms from Sudan virus disease, SVD, while in the outbreak area and after they come back for 21 days. Travelers should also self-isolate and contact local health authorities or a clinician if they develop symptoms early. Dry symptoms would include fever, aches, pains, fatigue, and later wet symptoms may include diarrhea, vomiting, and unexpected bleeding. So for right now, the government is allowing people to return from Uganda or who pass through there, just to self-isolate when they come back. So when did these 2 people that were hospitalized come back from Uganda? And how long were they there? And what was the reasoning that they were there? So they're saying that it wasn't Ebola, that it was possibly norovirus. You would think that after the last outbreak that shut so many businesses down and killed so many people, that we would have more of a restriction for different types of viruses, at least at the airports. What are your thoughts? Put your comments down below. Thank you very much for watching. Please like, share, and subscribe. And I'll talk to you later. God bless you all. Bye.